Dr. G, you mentioned your story. Do you want to share it?
Well, gee, where to start? So I, like most, I grew up in the 50s and 60s, and back then, kids get tonsillitis constantly, and everybody was always worried that it was strep throat, because if it's the wrong kind of strep throat, it's potentially a very dangerous illness. So my sister and I were constantly given antibiotics. And luckily, I guess for me, I kept my tonsils. My sister lost hers, because that's what you did back in those days. And when I was in college at Yale, I was constantly sick and getting sinus, quote, infections. And I was always in the infirmary getting antibiotics. And because that's what you did. And in fact, I missed 3 months of my second year at Yale because I was just sick and couldn't even go to school. Anyhow, fast forward during Yale, I had a special major in those dark ages where we could design our own major. Major I designed was the thesis. You had to defend a thesis. The thesis was you could take a great ape, manipulate its food supply, manipulate its environment, and prove you'd arrive at a human being. Pretty gutsy. And I actually defended my thesis, and I got it out, gave it to my parents, and went away and became a famous heart surgeon. So in that thesis, I showed that we were basically plant predators, but we had evolved with certain plants, and that there were plants that were introduced into our diet 1,000, 10,000 years ago in the forms of grains and beans, which had never been in any animal's diet because they were deadly unless they were cooked. And when humans started eating these, we actually shrunk a foot in 2,000 years. We were about 6 feet tall, and we shrunk a foot in 2,000 years. And there's never been a case of arthritis seen in a human skeleton before the advent of agriculture, ever. And you go, that's interesting. These plants don't want us to eat them. Fast forward, all of us are originally from Africa, Europe, or Asia. And none of us, not even Native Americans, are from North and South or Central America. We're all from somewhere else. So none of us ever encountered a New World plant until approximately 500 years ago, when Columbus started trade called Columbian trade. So many of our favorite foods are literally brand new. Fast forward, when I was a heart surgeon, like I said, I had all these conditions and it was normal. And then one day, fateful day, I met Big Ed, who reversed 50% of the blockages in his coronary arteries in 6 months by following a diet and taking some supplements from a health food store. And that's impossible if you believe the literature. You can't reverse coronary artery disease, and yet he did it. And when I started asking him about the diet he had been following, all of a sudden he starts describing my thesis of what he had taken away from his food. And when I started asking, he showed me the supplements he was taking. I was very famous for protecting the heart from damage during heart surgery and transplant. And I was putting this cool concoction of goodies down the veins and arteries of the heart. And in that concoction were a lot of the supplements he was swallowing. And it never occurred to me to swallow the dumb things. And I was a healthy guy running 30 miles a week, going to the gym 1 hour a day, and eating a healthy, low-fat vegetarian diet, which was the Adventist diet. And yet I was, 228 pounds and wore braces on my knees to run and had all these issues. So I actually called my parents in San Diego. I said, hey, do you still have my thesis? And they said, oh, yeah. They said, send it up. So I put myself on this thesis, and I lost 50 pounds the first year and another subsequent 20 pounds. And I started taking all these supplements. And really within months, my arthritis went away, my blood pressure went away, my cholesterol went away, my prediabetes went away. And my migraine headaches went away. And also, a fun story, anybody know what a trigger finger is? Anybody know what Dupuytren's contracture is? You see the TV commercials of flat palm if you can't put your hand on the table because you got all these contractures in your fingers, sometimes called the Irish disease. Anyhow, trigger fingers are if you move your finger, it catches. Now, if you're a heart surgeon, you really don't want trigger fingers, because if you're doing something delicate and your finger catches or then releases, that's probably not a good thing.
No.
And so I had trigger fingers, luckily, in my left hand. You could feel nodules in my tendons. And lo and behold, my trigger fingers went away. The nodules went away. And I go, well, that's kind of interesting. So I started putting my patients who I operated on my program after I operated on them. And it was really funny. They'd call in and say, hey, I'd send them to Costco or Trader Joe's for supplements. There wasn't an Amazon then. And they'd call in and say, hey, what supplement are you giving me that's making me dizzy? And my nurse and I would look at each other and go, there's nothing, that would make you dizzy. Come on into the clinic. And sure enough, their blood pressure was really low. And we go, and most of these folks are on 3 blood pressure medicines, because that's normal. And we go, well, let's get rid of one of those. And then, a couple of weeks would pass. I'm still dizzy. Well, get back in here. And their blood pressure would be really low. Well, let's get rid of that one. And so on. And then people would call and say, gee, I can't think straight. I'm really lightheaded. I think my blood sugar's low. And, well, get in here. And sure enough, their blood sugar's low. And they're on, 2 or 3 diabetes medications or even insulin. And we'd say, oh, let's get rid of these. And then we'd have people who were scheduled for a knee or a hip replacement. And they go, I'm going to cancel my knee replacement because my knee doesn't hurt me anymore. What do you think about that? Wow. And I go, that's pretty cool. So then on a fateful day, about a year later, I looked in the mirror before I went to work and I said, I got this all wrong. Instead of operating on people and then teaching them to avoid me in the future, I should teach them how to eat so I never have to operate on them in the first place.
Yes.
What a stupid idea. What a stupid career choice. As at the height of your career, I set up a clinic in Palm Springs, which is very near Loma Linda. And I just, because I'm a researcher, I just told my patients, I said, hey, I want to tell you to not eat certain foods, and I want to have you eat certain foods, and I want you to go to the health food store and buy a few supplements, and I want to track your blood every 3 months, and let's see what happens. And I said, insurance will pay for it, and let's see what happens. And so kind of the rest is history. And that's how it all started.
More amazing episodes just like this one. Watch now.
Some people think that I tell you to avoid all seeds. That's not true at all. There are certain seeds and certain nuts that you probably should avoid. On the other hand, there are certain seeds that are really good for you.